All right, thank you for joining us today. I have Anthony Kass, or Pete. And Pete, why don't you just start off with introducing yourself and tell us a little bit about yourself?
Yeah, so I'm a third year in the program. Um,
Just finishing up your third year.
yeah, I just finished up my third year. Currently coming off my first away from the program practica,
Okay.
which is currently at the Hampton Roads VA Center, Medical Center. I am 42, going on 43 in a couple of months. I'm retired military. I did 21 years. And so that's kind of what really brought me to psychology overall. I just felt called, if you will. The short story is I can actually remember in like 2012, my ship pulled into Boston, and we got to do we call them ComRails, Community Relations Project.
Yeah.
And it happened to be a homeless veterans shelter.
Oh.
And so we went there. It's this pretty incredible place. They do, it's an organization that was started, and they've got they feed like hundreds a day. They've got accommodations. It's like a 6 or 7 story office building that they've converted into like a homeless shelter. Pretty awesome thing. And obviously walking through that as a veteran, or at least at this point active duty service member, it was kind of like sadness, right? So when you see somebody like a family member or something that is in a bad place, it builds emotion, and I really felt that day. I was like, I need to do something. Like these are my people, if you will. And so that was kind of really like my call for action, if you will. My what really kind of pushed me towards psychology. I think I've always been very interested in psychology. I had the luxury, I don't know if this is a thing, but in high school I actually took psychology classes. We
really?
had psychology classes. And I really enjoyed that. Was always fascinated by the mind and just how it works. But 2012 was really like, all right, I'm going to do this, right? So at that point I had an associate's in social science.
Okay.
And so I just took that. I have lived in this area for 18 years now. So it was pretty easy. The school, I don't know if I can say the school or not.
Yeah.
All right. I know Regent, when I started my undergrad, Regent was really good at working with me in the context of the military.
Okay.
Obviously, there's a lot of flexibility of like, I'm here today and I'm gone tomorrow, or might we working late today, or I don't know what my schedule is going to be or what I'm dealing with from day to day due to the military lifestyle.
Yeah.
And so for me, Regent had a very supportive environment for that. Then I was doing a lot of online classes. Obviously, we don't do that at the graduate level. And so that kind of, it took me 5 years to get my bachelor's, right? But, throughout that's, I finished up my career in the military. And then I came back to Regent, pseudo kind of I think I remember when I started looking at grad programs, they're PhD versus Psyd, all the masters versus counseling versus social work, the whole spectrum of everything that falls under mental health. And for me, it was which one do I go? Okay, well, Regent is nearby, right? So that's easy. So what options do I have there? I was in the midst of retiring from the military, which there's so many bells and whistles. Like they're like, oh, have we poked you enough? Because we need to like stab you some more.
Yeah.
Medical wise, you're making sure you get all your VA benefits and closing out and like I legit had a full like work day on my last day of the my last work day was like a full day, right?
Of course.
I did have some leave. I had some leave or vacation. I don't know. I'm still trying to figure out how to talk civilian. And so I did have time off, but like my actual last full day was like full. So I didn't have a lot of time to like fully invest in the like send out 15 applications and do this and do that for like grad school. And I'm like, I got one shot. I live like 5 minutes from Regent. I got my undergrad there. I know they're super military supportive. Funny enough, obviously Regent is a Christian school. So that was actually really one of the things that strangely drew me. I am a Christian, but like honestly, the aspect of spirituality as a whole, not necessarily a particular religion, tying that to like actually looking at how that manifests as psychology, right? How does that work in, right? Because if we want to look at a whole person mentally, we want to look at how is their spirituality integrate with that, right? Because that's important. That for some people that's a very important aspect. And I will say not every program I looked at outside of Regent, some that were secular based, I didn't find that as much, right?
Yeah. I think when they said the APA accreditation, when they came through, they even said themselves, we don't see this integrated into...
Oh, yeah.
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 So
I remember that. That was pretty funny because I had the luxury of being a part of the support team for the APA on campus when they came on board. I was one of the students that they picked our brains. We're like, are they like...
Are you guys being taught?
Yeah.
No, or was it...
Yeah, it was kind of like that. They're like, are you guys actually being taught psychology? And we're like... Yeah, this is what we know. This is what we do. And they're like, and then there's the integration piece, right? So it was, that's kind of how I ended up as like.
So when you came time to apply for either a master's or Psyd, being as old as you are,
yeah, thanks.
Why did you choose the longer program?
So for me, obviously several reasons. Most states require a graduate program, at least currently. I know I think the APA has talked about possibly giving options for master's levels. I do know some states allow a master's level to get licensed. So for me, it was like, I knew I wanted to do clinical work. So that was part of the like, do I go PhD? Do I go Psyd? Obviously, most of the programs that I looked at for Psyd were more clinical focused versus research focused. Not that I don't want to do research, but it's not where I see myself in 10 years, right? Doing a lot of research. Most of the PhD programs I looked at paid full full ride, so that was kind of cool. And obviously, again, going back to Regent was here, there was a little bit of convenience, right? And they have a Psyd program that...
But why Psyd versus Masters? So you want to work with the veteran population?
Yeah.
And can you work at a VA, let's say, with a master? Okay.
Yeah, there you go. That's one of the key pieces.
Okay.
I don't know how that works in the states where you can get your master's. But I will tell you, if you look at...
We need more open doors with the Psyd.
I will say, I think when I was looking at USA Jobs, because I did for me, and I would say this to whatever focused job you want to look at is look at the job you want. And I know when I was looking at VA positions on USA Jobs,
.gov,
all the government jobs, and they were calling for a graduate or doctorate level. Now, that was a couple of years ago, so I could be wrong, or it could have changed by now. And oops, sorry.
No, I had a similar experience. So I remember before I joined the military, my dad asked me kind of what's one of the reasons I wanted to join. And I remember feeling like we have all these Americans going over to the Middle East, and they're all fighting and they're dying like daily, and I just want to be helping them, right?
Yeah.
That was like one of my first. And so I never did go over there. They sent me to Japan. But I remember it was around time I could decide if I wanted to get out after my 4 years or stay in.
Mm-hmm.
And I remember having some NCOs, staff NCOs, that I remember this sergeant that we had across the hall from me, you could hear him screaming at night sometimes from his time over in the Middle East, right? And so I remember thinking, same like you, like these are my, like I want to help them, and they're back home, they're here, they're all around, and they have PTSD, they're suffering from mental health, they're coming back, they're having a difficult time, and I can still serve them without necessarily being a part of the military anymore.
Mm-hmm.
And so I loved being in Okinawa, and I looked at usajobs.gov, and they had contracting positions on one of the biggest Air Force bases over there. And so I thought, that's my route. I'll leave, I'll go to grad school, I'll get licensed, and then I'll come back as a contractor. And so kind of a similar what brought me into psychology.
I will say, like, so I have to tell this story because it's so hilarious, right?
Yeah.
And it's ties to the Navy because, I tend to be a little blue and gold. So I was telling you about that nonprofit, right? So this big NGO, right? They, and their like third in command or whatever was a like retired chief of the boat. So this like crusty, like I'm gonna use the term angry, but like in a good way, old master chief. So I was a chief at the time. So I'm still kind of like, all right, this is really my people. But he was like their third in command. And apparently he like blackmailed the local VA to get medical support. So he's like, they built a fully functioning like medical clinic in the building, right? Paid for it. This program paid for it. But they also had a bunch of buses. And he went to the local VA and was like, hey, guys, I want to talk to you, right? So I have all these vets that need help, right? I have a lot of buses. And I can have all these vets on your front door every day of the week, all hours of the day, because I want them to be taken care of. Or...
Wow.
You can help staff my clinic, and we can set up as a VA clinic and do whatever it is to make it certified and stuff. And you send bodies there, and you don't have to see my buses. And they did.
Wow.
And so I had a like proud.
What a legend!
Like, yes. And I was like, man, I would love to work in that facility. But that's like part of the like drive to come here to do the Psyd thing. Again, the Psyd versus PhD was research versus like clinical. And I know that's not like, and I feel like we get a pretty, for a Psyd program, we still get a heavy load of research.
That's what I hear.
Although there seems to be a little less stress about it. I've gotten to talk to others in programs that are in the region. And it's a different like thought. So I think that's where I was. I think, did I cover all that?
Yeah, I think so. You basically got us up to speed where we are now.
Yeah.
And so you just finished your third year, and you mentioned this is your first year where you're away from the campus doing clinical work, and you got the honor and privilege of working at the Hampton VA.
Yeah.
So how was that?
So I would say overall I've enjoyed it. Coming from a military background, we can be biased about the VA, and sometimes I do get a little frustrated with the bureaucracy Maybe not within my like department where I work, but sometimes you can see how it's a medical center, so you're dealing with that. And I would imagine anywhere you go, there's some form of bureaucracy that you're going to deal with. But I think when you're a vet and it's in the VA, sometimes you get that like it's personal, right? So there are some days I get like grumpy in my little office, and I'm like, we can do better.
Yeah.
But, and this is what I would definitely say to anybody in this, you know, I took so much from the military, so I kind of still, you know, and I'm pretty sure you can imagine that, but like, I was always taught to like ask the questions, and like if you needed or wanted something, or if you saw something, have somebody tell you no. And so what I found is, even in the midst of the bureaucracy, you know, the first couple of months I was there, I really kind of dug down and like figured out the bureaucracy and kind of figure out how the gears work there, right? I did have a luxury. So my supervisor for my school clinic year actually worked at the VA. She's an executive up there. She's a psychologist, but she's also an executive. So I really I learned how to write notes for the VA a year before I ever stepped on it. So, and I, you know, cool shout out to this program. Like, they knew where I wanted to be, you know. In my interview, my interview before I ever got here, they're like, well, what are you, you know, do you know what you want? Like, what's your pops? I want to work with vets. I don't really care where. I'm interested in trauma. Like, that was kind of my, like, this is my flag. This is where I'm planting it. Yeah. You can't move me from this. Yeah. I will tell anybody, you know. And so I have continually, like, pushed towards that in the program, but I found, like, I have that mentorship. People know what I want to do. They're like, have guided me. And so like the year before, I had this, you know, supervisor, you know, she's already in the VA. Like, she works there. So I was already being prepped, you know, if I wanted to take that route this year. That's awesome. And then, you know, there was like 6 or 7 of us that interviewed, and only 3 of us got chosen. But even during my interview for the VA, I was like, so they're like, why are you here? I was like, I don't care where you send me. I just want to be working with veterans. Like, that's who I'm, like, this is why I'm here. This is what I'm planning, you know. And if it didn't work, I was going to do it again, right? Like, I'm going to keep asking until you tell me no, right? And if you give me another option, I'm going to ask again. And so I got in there. Unfortunately, you know, everybody's noticed we had COVID, right? So they were trying to figure that out. Yeah. You dealt with that this year too. And so I didn't get clients right away, and so I took that time to like figure out how the VA worked as much as I could from like the student, like you know, figured out how to work the systems as far as like the computers, and like put in all the data points and stuff, and then just kind of figured out like, oh, hey, look, this is how I can advocate for my clients, right? And I have used that, right, because, you know, it's figuring out the systems wherever you're at, wherever you go, whatever you want to work with. It's like, how does this system work, and how do I best contribute to the system to ultimately get my clients the support they need. And for the vets, for the VA, like, some of that is not necessarily mental health, but, you know, physical health, social support, being able to pay bills, being homeless, like, those are all significant factors that feed into mental health. So part of that is like, oh, I now know who the social worker is. Oh, I know who the homeless coordinator is. Oh, I know who our, you know, unfortunately, suicide coordinator, like the people, suicide prevention coordinators are. And you know, sharing that with your fellow students within that realm, right? So, you know, you make the group networking. And when they ask, I've got a vet in need. Oh, I've got a vet that's suicidal. I need gun locks, right? So how do we coordinate that? And I think that's kind of one of the bigger things, right? I was able to get all my hours I needed. I got a lot of intervention hours. I had initially coordinated pre-COVID a couple of assessments, so I didn't get to do any assessments. Possible art therapy training.
Oh, cool.
But those things had to unfortunately get put on the back burner because accessibility and stuff. But I was going to make the best of the situation, even if I was not, if I didn't get all the intervention hours I needed because of COVID.
How many hours did you need?
Well, about 150.
Okay.
Like I was trying to shoot for. I ended up with like 170. So,
okay.
I was well over my other hours overall, but and so that was kind of my goal. Was like, well, if I'm here, and even if I'm not seeing clients, what do I best use of my time, right?
Mm-hmm, mm-hmm.
I know I want to work within at least with vets. Mm-hmm. Obviously, the VA is the largest service provider to vets, so it's kind of a happy fit.
Yeah.
My supervisor from last year, she's pretty much become my mentor. I go and pick her brain anytime I have a minor. Like, hey, what about this? What about this? How do I do this? My supervisor for this year was really great. I don't think I said it, but I had the luxury of actually working in the trauma clinic.
Oh, okay.
Which, again...
You've gotten all the...
Oh, yeah.
Yeah.
Although there's a slight...
Well, except for COVID.
Yeah, with exception to COVID. But, and that's kind of like...
There's a slight... What were you going to say?
Oh, so there's a slight funny... So I got a little bit of a head fake, right? So I came into the program, right? And just trauma. That's like the only word I knew how to say between vets and trauma. That's all I said. And I started to... So we'll probably talk a little bit about classes, but I did the group therapy class a year early, and was like, part of that is doing group therapy, right? Mm-hmm. And so we did it in the clinic, and I happened to fall in the chronic pain and illness group, right? Mm-hmm. And I was like, all right, cool. It's interesting. Like, this is fascinating. Due to some family members that have dealt with chronic pain, so it kind of helps me understand that kind of experience, right? Yeah. And so I was like, all right, cool. And then other things about health psych kept popping up, and I started working for the health psych professor as his TA, to research assistant, and so I started having to go to the health psych research team, and I didn't have as much time for trauma. So I'm thinking, all right, well, I'm going to a hospital, and I was like, all right, well, I'm going to interview for the VA, right? And I by that point, I'm kind of almost embedded in chronic pain and trauma. I'm like, this can go either way, or primary care, and I'm like, these are different routes, significantly different mentalities of slightly. Well, chronic pain and trauma can go hand in hand, but I'm like, primary care is short, quick. Trauma is hey, we're just hanging out forever. Mm-hmm. Not ever, but long therapy, right? Yeah. And I'm like, all right, so I was a part of the trauma research team. Day one, our trauma research professor, or the one that does the research team, I was like, I'm going to be your first person in there, and I was. And then promptly, because of just time management and everything, I had to, because I worked for the health psych professor, had to do that. And now he's also my dissertation chair, so I have to be going to that research team. And I'm like, so I go into the VA. I'm thinking all right, I don't know where I'm going. Maybe it's just behavioral health, whatever. But they're like, well, what areas would you like? And I'm like, I like primary care, chronic pain, and trauma. And I'm like, I saw the list of the specialties, and they sent some people to just behavioral health. And they had a primary care, chronic pain, and they had a trauma. And I'm like, I'm gonna end up in the because I'm just thinking like, I came in just saying this is my interest, this is my interest, and I'm like, and I've done a like switch, and I'm like, and then I got the email and they're like, you're gonna go to trauma, and I was like, oh, okay, right, this is where we're going now, like, this is how this is going, and that, so I was not expecting that, right, like, but it's been really great. I've super enjoyed it. I would say one of the big checks in the block, and I know this sounds really weird, that I wanted to do, I wanted to see if I could even deal with trauma. Like, because, I mean, I hate to say it, but it's, I mean, like, the stuff I've heard this year, I mean, I could definitely, it would, it can be heart-wrenching, right? Some of the stories I've already heard and kind of like, and I was able to like hear it, process it, do my own like internalizing, or I don't want to say internalizing, but like, work with my supervisors, so, I go home and it stays back in Hampton.
Good.
And I think
that can be very difficult to do.
Yeah, I was going to say, that was kind of my challenge. I was like, well, this is going to be the year, like, if I'm working in trauma.
Well, let me ask you, so I was, maybe whereas 10 years ago, you may have had, I have no idea. So the way that it seems to me is 10 years ago, you would have had a whole lot more PTSD type cases, people coming back, getting out. What is most of the trauma that you saw pop up now?
Well, obviously the VA is catering to like all of our veterans, right? Yeah. So I had, so I dealt with some OIF.
Operation Iraqi Freedom?
Yeah, I was going to say, well, OEF, OIF stuff. Yeah.
So some older vets maybe.
Well, those are still younger vets. I mean, so I've had vets. Let's see, my range at this point. So I've gone from probably guys in their early 20s all the way to like a guy in his like 70s. So we legit like we're talking about like Vietnam era and stuff like that. So
I guess I was thinking older than myself, but you're also like a decade older than I am. But because many people commonly point out in this program, I was thinking, most people who served in OIF and OEF, if they got out and now they're veterans, they either did 4 to 8 years and got out, or that was one of their last tours maybe. So I guess any age range between OIF and OEF would be like between 30 and 45.
Technically, well, I guess we just got out of Afghanistan this
a few days ago.
So that's still technically considered like OIF, OEF.
Yeah. I just wanted to imagine
maybe they have a different name, but
I just wanted to imagine that out of the small population that were still there, that maybe you would see a whole lot here in Virginia.
So, but you got to remember we have the Navy, right? So not all trauma is combat trauma, right? Especially when you think of like, we had the 2 major accidents last year in the Pacific with the 2 ships, or a couple of years ago. And so
a lot of training accidents and stuff too.
Well, yeah, that can be just as detrimental. Yeah. And just, I think that's one of the things that people who've never been in or around the military is like, going to war is going to war, and it has its own like complications, right? The moral and ethical stuff, guilt and shame if you were a survivor, but you also look at stuff that's non-combat. Like our training is as dangerous. Yeah. Just going to work, it can be incredibly dangerous because we're training with sometimes live weapons, live ordnance, ships at sea, jets crash.
I had a client that he witnessed there was I think 5 to 7 guys on his ship, and in the boiler room something happened, and the boiler room malfunctioned, and 5 to 7 of them died in the boiler room, like stuff like that, right?
So I would say like some of my early ones were actually like at sea type accidents, right? So had a guy that he was on an aircraft carrier, and the accident, like a cable parted, and one of his like sailors basically got cut in half, right? Wow. So that was probably my first and I was like, all right, cool, let's do it. And I knew that's it, but like okay, let's how do we work with this? And so that's kind of the like the spectrum, right? I've dealt with individuals going through combat trauma, but also like things that weren't necessarily combat, could have been training, just people lost at sea.
Did you do much sexual trauma?
I actually have only worked with one client with sexual trauma. They actually have a specialty clinic for that, a different specialty clinic that kind of focuses more on that. So most of what I dealt with is military-based trauma. And the only reason I worked with the particular client and their sexual trauma was because they hadn't told anybody about it. So.
Okay. Man. So, how many? And you did most of that telehealth too, right? With COVID, even trauma?
I did all telehealth.
All telehealth.
Yeah.
And was it manualized treatments, or for the most part?
Yeah. So most of what I did there was manualized treatment. I did kind of like. So you kind of had to follow the structure with some of the stuff, but we also did a lot of like coping skill development. I did a couple of groups that were like coping skill building. And that was kind of like free flow, but I always like to try to incorporate like that processing aspect. We did a lot of CPT. I never got to do full-blown prolonged exposure because that's kind of a thing you have to be really trained for. But like I did work on a exposure hierarchy with a client. We kind of use that as like a template.
Can you talk a little bit about the exposure hierarchy?
Yeah, so basically the exposure hierarchy, and it's not just for trauma, it can be used for like anxiety and some other stuff, is you're basically having the client kind of develop their own hierarchy tree, and we use 0 to 10, but it's basically a low hierarchy to a hierarchy, and doing an experience or thinking about a situation and how difficult or how much distress I think is probably the best way to explain it, causes them, right? So I will say one of the guys that I worked with, like his hierarchy, like one of his 0 was like, I'm home and like I can see all the windows and that those PTSD symptoms, right? Hypervigilance, stuff like this. And he and so like his 10 was like sit in a very crowded room for like 38 minutes to an hour where I don't know people and things going on. And that, I will say, funny enough, we kind of worked through, right? Hey, and kind of like you're doing a lot of like coaching as far as like, hey, recommendation, like I need you to go out and like, we need to kind of push this, but don't push it too hard.
Kind of like a challenge for the week or something.
Yeah, like this is the challenge for the week. I know for PE, like it's a little bit more like a prolonged exposure. Like it's a little bit more like this is you do this, you do that. From what I've kind of looked over and read, but for like him, he was kind of a success story. We kind of talked through. He was actually able to go and sit in his like son's graduation.
Wow, good.
And like
that's
a big auditorium. He did have some like distress during that period of time, but like he was actually able to sit through, and it was like an hour and a half, which was like 3 times as long as we were able to kind of talk through.
I heard, I might get this wrong, but I heard it's it's not that they necessarily become less distressed or less anxious. They just get braver, something like that. I might have that wrong, but yeah. But that's really.
I guess
cool.
I'll agree with that.
That's really neat, though. That's when you get to see at the end and then they've come such a long way.
Yeah, I will say, like, so I know everybody's got like their theories they follow, and I know here they're very heavy on the like cognitive behavioral stuff, and I know that's pretty typical. I would say, like, so for me, I'm definitely like, maybe I'm a closet humanist, right?
Okay.
So like, I'm always like, how do we make the meaning of this? Like, so especially with exposure hierarchy, like that was kind of like the idea, like, what is your 10 and why do we want to do it, right?
Yeah.
Like, I mean, just saying I want to go work out isn't always the most, like, okay, but I also want to eat a chocolate cake. But if I want to work out because I want to go and run the Boston Marathon, or I want to be able to totally crash, but my buddy works out because when he's 70 years old, he wants to be able to lift himself off the toilet, right? So, but there's meaning in that.
You have to have a why, right?
You have to have a why.
Yeah.
And that's been one of the things I think I have kind of done well. I think most of the time with most of my clients is the why. You know, or at least I've gotten better. I would say that's one of the things I've gotten better with this year, and
that's good. Me and Erica were talking about EFT.
Okay.
And she was saying how if you're going to use something like emotion focused therapy, especially maybe with a male client who is maybe somewhat averse to talking about their emotions, a lot of times I think, at least from our own personal experience, even with whatever it was, whatever type of therapy we were doing, we basically told the client, okay, this is what I think is the best fit for you, and it's either we're going to get into your emotions and we're going to talk about them, or we're going to talk about the way your thought patterns affect your emotional state and then your behaviors. But we have never maybe like taken the first 1 or 2 sessions and just talking about this is why, and this is like, and asking them from their point of view, how do you think that this would be helpful for you? And then explaining, kind of giving some psychoeducation behind the theory instead of just jumping right into it. Set up time, because then they'll be so much more invested into instead of saying, okay, I show up to therapy, we do some worksheets on my thoughts, or we do some worksheets on how I felt the other day, and I leave. I might have felt a little bit better, but if they show up and they know that, okay, this is why we're working on this specific area. Because I had I had a male client who was basically what's going to be beneficial about us talking about my emotions, and that
makes sense. Right? That's situational norm for most males.
Yeah, right? and if you are so driven by like progress, for one, you're driven by you just want to fix everything, right? And so you see the landscape and you see, okay, I'm not getting out of bed on time, I'm not making it to work on time, I'm not doing this, so what can I do to start a better pattern? And so that's what you want to tackle. You don't want to spend all this time talking about so
well. And I would also say, like, I had similar experiences. So one of the therapies that I got to do was a cognitive behavioral therapy for insomnia, right? Okay. So obviously trauma, you get that insomnia aspect. And so in the process, I had, you have your client, or in this case, your veteran, right? Because that's how we call them.
Okay.
And you basically say, like, I need you to wake up at this time, like, and they're like, but I'm not sleeping. You're telling me to wake up or go to bed later. I'm actually not sleeping. And so part of that is actually doing the psychoed, right? So you're trying to condense the wake up and go to bedtime, because it's better to get that like solid sleeping versus a broken like longer period of time. But you add meaning to that, right? So part of it is like, all right, so what do you like to do, like, or I mean, for me it's coffee, right? So I always got to throw in that coffee piece, but I'm like, it's okay to get up and have that cup of coffee or take a shower, and like you don't have to be fully awake, but like to start the body moving. And do you like sunrises, or like what do you I may have recommended silly YouTube videos.
Okay.
I don't know if you've ever heard of Aussie Man.
No.
He's this crazy Australian that kind of picks on other people's videos. I was like, you should watch that. And,
is he the one that narrates them?
Yes.
Not really narrates, but
yes,
okay,
yes.
Yeah, he's funny.
Yeah. And so I was like, well, because this guy was hilarious too. He's like, I'm so upset, like, now that Trump's out of office. He's like, man, that man had the funniest tweets. Like, he's like, I would wake up just to read the tweets. Like, I don't care about the politics. Yeah. I'm just like, that man is just nothing but trash talk. Like, he's like, and so I think for me, again, I do come from, it's been called a style, but like, how do I make meaning into this interaction, right? How do we, and then the other piece was like, all right, let's acknowledge the fact that especially when you're talking about trauma, in some cases, like, let's acknowledge the fact that we might be taking something that's been a part of your identity for many, many years, right? Yeah. Or even if you're talking about chronic pain, like, we may be working at removing something that was a part of your identity. So how do we fill that, right? So, like, that's been kind of my experience. And I feel like that's something that I got to develop a lot more this year. Not that we didn't do it last year, but like last year I'm like still trying to figure out how to even be a clinician, right? Yeah. And this year you're kind of thrown into the deep end because you're like, I can't look back and go, like, there's not all these professors, right? You have your supervisor. And I know, like, talking to my classmates, every supervisor is different. And every organization that they've worked in, like, my experiences are slightly different than others in my cohort because of where they were and what type of, focus that was on. I feel like I had a very great relationship with my supervisor this year. I had a very great relationship with my supervisor last year. My supervisor this year was, but like different personalities, right? Yeah. So my supervisor last year, she was former Army officer, so like we got along swimmingly, but it was also like, I don't need all the like extra, like, I'm like, look, you're not going to insult me. I've done 21 years in the military. Like, I've been yelled at by better. Like, you can't yell at me. Yeah. So, like, but tell me where I did wrong. And, I think I was talking to somebody recently. The funny thing is, I'm going to go a little off the range, but like, and maybe you've had this experience. You can probably identify, like, I think there's an internal critique. Like, anybody who spent 5 minutes in the military, like, we are our harshest critics. We'll smile and nod at everybody, but like, so like any little nuance, I'm like, all right, how do I not in a like, oh, I'm a terrible person, but like, how do I fix this? How do I get better? How do I do this? Like, this isn't perfect. Yeah. And I think part of it I had to like acknowledge that nothing's. The good thing about my job is I learned my previous job was 80% is all we need. Like, do it at 80%, but like do it now at 80%. Yeah. And so I've heard some people talk about how their interactions with their supervisor, like sweating it, and like I know for me, one of the funniest experiences last year with the supervisor from last year, and she's like looking through stuff, like she's checking my notes. All right, like, you can do this better, and you can do that better, and we can say this better, and this is the term succinct. One of those catchphrases that you learn in grad school. And I'm like, so like in my head I'm like, all right, so like, did I do good? So, like, what with it? And she's like, oh, your nose fine, like, or what was developmentally
appropriate,
which apparently everybody hates. I don't know. I'm like, okay, cool. This is where I'm supposed to be. Like, I can grow, but I'm like, this is where I'm supposed. All right, cool. This is the plateau. But she said something like, yeah, this note is perfectly fine. Okay. I'm just being critiquey. And I was like, that's the greatest compliment you could ever give me. Because that's how we think in the military.
Yeah.
I was like, oh, it's in the 80%, and it just could be better? Okay, cool. Right? We're where we need to be.
Yeah.
But the cool thing was, like, I worked with her all last year. I walked in and knew how to write notes, like, the first week. Like, my supervisor's like, wow, these are some of the best notes I've seen. I was like, yeah, I've been working for a VA rep for the last year. So, yeah, I think that's been kind of my experience from the Practica site.
So you would say that up until now, or maybe just this past year, the main takeaway for you as a clinician is working from maybe like a meaning-based approach. Mm-hmm. Have you ever read Viktor Frankl's Man's Search for Meaning?
I love Viktor Frankl. So
okay.
Yeah.
Cool. Yeah. Such a good book. Yeah. Highly recommend. Okay, so outside of the Practica experience, you also had coursework. And you mentioned you're a GA, right? A graduate assistant, so you're helping. So can you kind of talk about what that life is like?
So obviously the coursework.
What class? First, what do you remember?
Oh gosh.
Yeah, first semester, third year.
First semester, third year. It's kind of a block. Mm-hmm. Meanwhile, still going through COVID, by the way. So obviously there were 4. We did our case presentation, so that's just, it is what it is. Yeah. I will say, totally silly, off the wall. Okay. But my whole year's presentation, especially since I was in the VA, we always put pseudonyms on our cases. Yeah. Was G.I. Joe.
Nice.
And my first one, obviously, because Navy, had to be shipwreck. I was like, all right, cool, I got a Navy guy. Yeah. He's shipwreck. Nice. Yeah, that's the very basis of why I chose my first case to present on. Because he was Navy and I call him shipwreck. So let's see. Social psych, which is actually pretty interesting. I've always kind of been fascinated. I sometimes get confused because in my undergrad I took a social psych course. Yeah. And it was nothing like the social psych course I took. Like, apparently there's like sociology, social psych, and then there's psychology, social psych.
Interesting.
You'll learn that soon enough.
Okay.
So that was that. My elective was actually I took the.
It's always so hard to remember.
Private practice. It was the private practice.
They have a private practice elective?
We had one. I don't know if there's going to be one in the future.
Oh, man, that's cool.
Yeah, it was pretty awesome. And then I think developmental psych was the other one. It sounds about right. Because that's the second part of the child psych. So those were interesting. I liked the private practice one just because it was the better alternative. It was more of the like, actually, that's not true. The reason why I chose the private practice one, because it was more of like leadership / private practice, okay, or organizational like management in psychology.
Business.
Yeah, that's actually what I think they called it. Business business for psychology or psychology. Yeah.
Yeah. Okay.
But it was much more focused on private practice. The reason why I liked that, or the reason why I chose that over, I think neuropsych was the other alternative, is I would actually, again, going back to being a veteran and providing services to veterans, and the bureaucracy and all that stuff. I want leadership. Yeah, I want to be in charge at some point. I don't know what that looks like and where, at what tier, I guess. But again, going back to my mentor from last year, she's in the executive role over there. She's in an executive role over there, a leadership position.
Okay.
We've talked about that, because at the end of the day, if you want, the advocacy is good, and I use that to my best ability on where I was at, right? So a student, but like, you want to be in the rooms that are making the decisions. And
does she still see clients?
She does now. She actually wasn't for a while, and now she is seeing clients again.
So you could theoretically do both.
That would be my happy place.
Okay.
That's when I think of 5 years down the road, 6 years, 10 years, whatever. That's my happy place, right?
Okay.
Not maybe seeing. And funny enough, she's actually doing some stuff with like a combined, integrated, and a different term that we used here, but like chronic pain and PTSD protocol.
Oh.
Wow. Yeah. I'm like,
yeah.
5 years, 10 years, I'm telling you, man. That's what I'm shooting for.
Yeah.
My meaning. See how I did that?
That's good.
And so like, that was first semester. Second semester was kind of that professional development where you're kind of trying to get your dissertation proposed for, which I had a little bit of a stumble. I think we talked about, I'm now on the 6-year program.
Oh,
so I took an extra year.
Yeah.
I don't know if that breaks up your...
No, that's okay. You're good.
A lot of things happen. So going back to like my flag, like this is where I'm planting myself and all that stuff. I'm doing research with the VA as my dissertation.
Cool.
And unfortunately, we had some hurdles with COVID, and like even the guy that I was supposed to, like my rep at the VA, actually passed away. Not from COVID, but like. So like there was about a month and a half, I'm like writing people and I'm like, hey, what is this? Is this thing still going? And I got an email back from some of the other like professors or doctors that I'm working with out there, and they're like, yeah, so Mr. So-and-so passed away. And I was like, oh, that's gonna be. So that was actually a hurdle, and honestly. But it was a good. I'll be honest with you. It was very good. I've got some personal things going on that kind of stumbling over myself, like, and it was like I was just like I've got all this stuff. It's all piling up. I think I could get it where like I could push through. Right, we're a 5-year program. We're military. We can get 4 hours of sleep for the next year and a half. And I'm like, but like.
For what?
Yeah. It also, so going into the classes, right? So we had affect and cognition, which talks about motivation, and I'm like, oh, this is reward and all that stuff. And I was like, oh, this is a cool class. Health psych. Obviously, I'm big on health psych. I worked for the professor. Another practica class, case class, our professional development thing. And I think we had... what elective did I take last semester? Psychopharmacology.
Oh, okay.
Right? So...
I heard that's a tough one.
It's tough because it's 6 o'clock at night after my clinic day. It's tough staying awake. No, it's tough, but it was really fascinating. Like I'm definitely... I went in kind of curious. Like I've probably been one of those guys that have been like, I'm much more on the therapy side of things. After leaving that, I think I feel like I'm more comfortable, like, obviously not prescribing, because there's a lot to that, but like feeling comfortable, like even reading them, what does this mean? What is
and so us as a Psyd psychologists, we're not able to prescribe, but what
you can get licensed
you can
as a prescribing in certain states and or organizations. So
you got to go to extra training, extra schooling for it. But this class
he said 2 or 3 extra years, so you're basically covering the medical piece that you don't get in psychology.
And the psychopharmacology class, basically you just learn all the different, so that way when people come to you and they say this is what I'm taking, you kind of at least just it's more for your own knowledge and.
Yeah, and I'll be honest. This sounds really weird, but I feel like this might be overstepping my bounds here. But I almost feel like it should have been a required course, versus like an elective. And just because, like, I feel much more comfortable looking at, and like I'm not trying to prescribe, but I'm like, that's also that's what's interfering. He can't. My veteran can't sleep. Okay, this is why. Or this might be causing, like, I feel a little bit more savvy about that. It's still learning. Like, you're not going to pick it all up in a one semester class. But yeah, so that was one thing I did decide when everything was kind of coming to head. I was like, I think I'm going to just take another year. I would definitely say anybody listening to this who is currently going through whatever program they're going through, like, it is okay to take that extra year. Like, I had a lot of personal stuff going on. I still going through it, but I feel like that extra year gives me a little bit of a buffer. I would also say, like, at the time, every class in spring were classes I was looking forward to. I was going to class and I was like, why am I like looking at my clock, like my watch or my phone, and like, why my hair? Like, I'm not even enjoying. Like, I love health psych, and I was like, why my hair? Like, what are you? I did really poorly on our midterm. Probably a little bit of column A of like just. I was like, I barely even wanted to be on school grounds. And you know me, I tend to be a very like
always upbeat.
I wasn't upbeat. Affect and cognition, I always very fascinated by that stuff. It's a very science-based course, heavy research, and I was like, man, I am not psychopharm. Like, the teacher is a like Navy captain, so he's like super excited too. I was like not enjoying any of it, and I'm like, I can't be doing this for another 2 years. I need some breathing space.
Yeah, I will second that, because I'm on the 6-year program too.
Okay.
And when I first brought it up, I thought I was going to get some slack for it, and my faculty advisor, she was like, no, I think that's great. I recommend it for you. And I was looking at basically, from my understanding, the only con is that it's an extra year that I'll be in school, that I'm not out working, making money. But it's an extra year that I'll have more clinical hours than a lot of my peers. And I'll have, my main thing, I'm not a super type A, I'm not a super go-get-em personality. And so I just want to enjoy school. I want to enjoy my classes. I don't want to feel rushed. I don't want to feel super tired the whole time. I want to do reading in my off time, and so that's kind of my decision.
Yeah, that enjoyment factor was strangely a big indicator. I was like, it's time to just call it and switch.
Yeah.
And this is gonna sound really off, but again, going back to that, everything goes back to that initial like mission goal, right? I want to help veterans, right? And so I can do my dissertation, right? And that's great, right? And I'm doing it with the VA. But that doesn't, I want to publish, right? And I'm not like, that may be the only thing I ever publish in my life. But I want to publish because I want that research to go back and feed decision making on how we care for our vets, right? That's important to me. I'm not here to get, I don't really care if anybody ever calls me doctor, although at this point most of my vets call me, even though I'm like, I'm not a doctor. Not a doctor. Not there yet. I think even some of the doctors call me doctor, and I'm like I've said it a couple of times, I'm just, what,
what's your research topic on?
So I'm actually looking at problem solving therapy in the group format, and whether or not veterans, the impact of depression with veterans with comorbid anxiety that are going to a problem-solving therapy group. So, and we've been able to link up with the local VA, and I'll actually be doing most of my research on primary care, people in primary care. So,
cool.
Continuing to learning how the VA as an organization works from the medical side.
That's cool. And this upcoming year,
yes.
Do you already know where you're going after the VA?
I do.
Where are you going?
So, in lieu of my lack of assessment hours, I'm actually going to a full-blown assessment clinic. So, but apparently they work with veterans a lot, so I'm kind of excited about that too. There might be some neuropsych testing, and I'm trying to. It's a little bit student based. I'm trying to see if the local Navy hospital, because they typically took us as students, but obviously with COVID and everything, they hadn't been able to take students this year. I've been negotiating with actually who was our psychopharmacology teacher. And he's trying to see if he can get some of the students there. Again, trying to keep within that. But if it comes up again next year, I mean, if they don't open until next year, then I'll probably try to do it again. I'm also going back to the chronic pain group here as a facilitator, so I'm going to get to go back to the chronic pain group. Kind of diversifying my portfolio, if you will. And then if I don't get picked up at the hospital, then what I'll probably try to do, the Navy hospital, what I'll probably try to do is, I think late fall they start looking at other second sites. So I don't want to forget how to do intervention in the year over the next year. So I'd like to have at least a nice little set of hours.
Do you think that with the VA being so therapy laden that do you feel that way about assessment right now? Do you feel like you've forgotten?
Oh yeah.
Okay.
It'll be fun. I'm gonna probably have to spend the first week, but it sounds like they have so many different therapy or so many different assessments there that I feel like I would be learning stuff anyway. Apparently we might learn some neuropsych stuff.
Cool.
So I'm. Well, and what is it? We learned the MMPI 2, right? Yeah. And the MMPI 3 is out. I've never been trained on that. I'm like, all right. And I never did the projective testing, so I may or may not learn that.
Yeah, I just finished with my elective this past semester. I did the ink blot, the Rorschach test, the performance based. That was really fun.
Oh, so I took, I don't want to call it the easy, but I took the short, mainly because it was Dr. Yarhouse.
Yeah, I want to get in contact with him. I want to see if he'll.
Oh man, I bet you he would.
Real quick, I had one more. Oh, any advice that if someone is listening to this and they're thinking about going into a doctoral program, so I would say to touch on kind of us both going into a 6-year track and it seeming a positive thing for both of us. I would say that one of the things I would say you're not holden to the normal 5-year path. You can kind of carve your own way, make your own path, and to me just personally, I would say try to actually enjoy your time and apply yourself, and you're going to be able to apply yourself, and you're going to do much better learning if you're not so tired all the time. But what would you say for any type of advice for someone?
I tend to advise a lot, so
it's the
whether people want it or
problem
not,
solving.
I think, it's the problem solving. I think some of it is give yourself some I don't want to use the term grace, but consider what you're doing, and like this is like grown people stuff, right? It's hard work. Acknowledge that it's hard, and acknowledge that it's hard, but like even if you're falling slightly short, like you're still doing the work, right? 100% doesn't always have to be the goal. Like consider what your goal is long term. Have a 5-year plan. Have why are you doing this? Why are you getting punched in the face academically or clinically every week? Like, because I mean, you could probably attest to that. Like it's a punch. Some days it's like
I don't know how many times I thought I should just drop out, or I should just go get my master's, or and you really do. It does come back to knowing your why. Yeah,
the why has kind of been my strongest, and I've had the luxury of working at the VA this year. I had the luxury of working within trauma at the VA, but like even on my bad VA days, like I drive home pretty happy because I'm doing exactly what I wanted to do from day one.
Yeah. I remember, speaking of earlier when you said, me, I'm a pretty, positive. I remember when you told me the first time, you were telling me how you drive, when you go through the tunnel, the Hampton, is it the Hampton tunnel?
Yeah.
You go through the tunnel and you're just smiling because you're almost to work. And I was telling Erica, I was like, that's who we need in programs like this, or that's who we need helping veterans. You need people who are excited about what they do and leave work at the end of the day smiling because they know that they've made a difference and they're doing exactly what they got out of the military knowing that they wanted to do. And so I hope...
And I would say that with whatever, right? So for me, it's always been the vets. But like I know people who want to work community care with homeless individuals or like, sexual trauma, which... That you got to know your why, right? Because that's a different level of experience, right? Combat trauma has its, and general trauma, but like sexual, I mean, you got to know your why because you're gonna hear dark stories. You're gonna have, and those are obviously for me it's trauma, but like I know some people want to work within like the prison system. And you've got to know why you want to be there because you're going to burn out, even as a student. And I would say the other thing is, like, take care of yourself. Yeah, maybe taking a loan here, an extra student loan, or how that looks. Know your hobbies. Know what's going to give you your... And have a circle of friends, whatever that looks, social circle. Even if you're an introvert, if it's just one person on the planet that you're like, that's my person, that's my social circle, and be comfortable about being honest. And I guess the token always go to therapy. I mean, I guess we should, as therapists, we should always advocate.
We should always advocate for therapy. Yep. All right, Pete. Well, thank you so much for joining us today.
Thanks, man.
Yeah, it's been a pleasure and an honor, and I wish you the best of luck at your assessment site, and we'll see you around.
Awesome.
All right. Thanks, buddy.